Patient transfer. Introduction. The patient is usually hospitalized in the same department from which they are discharged. The health condition changes in some patients so much that they are transferred and treated by another department or another treatment unit of the same or different department or in the same or another healthcare facility. Definition. Transfer is defined as preparing patient, completing necessary records and shifting patient to another department within the hospital or to another hospital home. Transfer referral is the preparation of a patient and the referral records to shift the patient to other department within the hospital or to another hospital. Purpose. To obtain necessary diagnostic tests and procedure. To provide treatment and nursing care. To provide specialized care. To place most appropriate utilization or available personnel and services. To match intensity of nursing care based on patient's level of needs and problems. Preparation includes an explanation of the transfer to the patient and his family, discussion of the patient's condition and care plan with the staff at the receiving unit or facility, arrangements of transportation, if necessary, types of transfer of the patient, internal transfer, to transfer the patient in a unit that provides special care or care suited to his needs, e.g. from general ward to ICU, external transfer, to transfer the patient from one hospital to other hospital for the purpose of special care, e.g. from general hospital to specialized hospital cancer center. Preliminary assessment. Assess the method for transport, inform receiving nurse. Maintain patient's physical well-being during transport to new nursing unit. Provide verbal report about patient's condition to the receiving unit nurse. Be sure all documentation including care plan is completed. Assist patient's arrival to the new unit. Announce patient's arrival to the new unit. Transport patient to a new room and assist in transfer to bed. Hand over to receiving nurse. Equipment. Wheelchair stretcher. Identification labels. Patient's belongings. X-rays, investigation reports, patient record and file. Preliminary assessment. Check the doctor's order for transfer of patient. Inform the patient and relatives. Inform to the ward sister where the patient needs to be transferred. Check the chart for complete recording of vital signs, nursing care and treatment given. Collect patient's X-ray, medicine and other belongings. Cancel the hospital diet or transfer. Assist the relatives to collect other belongings. Make arrangement to settle the due bills if going to another hospital. Record time, mode of transfer and general condition of the patient. Assist in transferring risk patient to wheelchair stretcher and accompany patient to new area. Hand over patient documents, belongings and report verbally to the in-charge nurse and sister. Collect the ward articles. Inform to the concerned person department regarding transfer of the patient. Clean unit thoroughly and keep ready for next patient. Procedure. Explain the transfer to the patient and his family. If the patient is anxious about the transfer or his condition precludes patient teaching, be sure to explain the reason for the transfer to his family members, especially if the transfer is the result of a serious change in the patient's condition. Assess his physical condition to determine the means of transfer, such as a wheelchair or a stretcher. Using the admissions inventory of belongings as a checklist, collect the patient's property. Be sure to check the entire room, including the closet, bedside stand, over-bed table, and bathroom. Gather the patient's medications from the cart and the refrigerator. If the patient is being transferred to another unit, send the medications to the receiving unit. If he is being transferred to another facility, return them to the pharmacy. Notify the business office and other appropriate departments of the transfer. Have a staff person notify the dietary department, the pharmacy, and the facility telephone operator about the transfer, if within the facility. Contact the nursing staff on the receiving unit about the patient's condition and drug regimen and review the patient's nursing care plan with them to ensure continuity of care. Transfer within the family. If the patient is being transferred from OR to an intensive care unit, your facility may require new care orders from the patient's physician. Send the patient's chart, laboratory request slips, codex, special equipment, and other required materials to the receiving unit. Use the wheelchair to transport the ambulatory patient to the newly assigned room. Introduce the patient to the nursing staff at the receiving unit. Then take the patient to his room and, depending on his condition, place him in the bed or seat him in a chair. Introduce him to his new roommate, if appropriate, and tell him about any unfamiliar equipment such as the call bell. Transfer to an extended care facility. Make sure the patient's physician has written the transfer order on his chart and has completed the special transfer form. This form should include the patient's diagnosis, care summary, drug regimen, and special care instructions, such as diet and physical therapy. Complete the nursing summary, including the patient's assessment, progress, required nursing treatments, and special needs, to ensure continuity of care. Keep one copy of the transfer form and the nursing summary with the patient's chart, and forward the other copies to the receiving facility. Transfer to an acute care facility. Make sure the physicians have written the transfer order on the patient's chart and has completed the transfer form as discussed above. Then complete the nursing summary. Depending on the physician's instructions, send one copy of the transfer form and nursing summary and photocopies of pertinent excerpts from the patient's chart such as laboratory test and X-ray results, patient history and physical progress notes, and record of vital signs to the receiving facility with the patient. Special considerations. If the patient requires an ambulance to take him to another facility, arrange transportation with the Social Services Department. Ensure that the necessary equipment is assembled to provide care during transport. Documentation. Record the time and date of transfer, the patient's condition during transfer, the name of the receiving unit or facility, and the means of transportation.